Welcome to Technology 101 for older adults towards independent living. So our speaker for today is Dr. Hakima. Dr. Hakima is a consultant physician and geriatrician from University Putra, Malaysia. She graduated in 2007 with a medical bachelor and bachelor of surgery (MBBS) from Jordan University of Science and Technology, Jordan, and later awarded a membership of Royal College of Physicians, United Kingdom, to practice as an internal medicine specialist in 2014. She completed her subspecialty training in geriatric medicine with clinical experiences both in Malaysia and the UK in 2020. She is currently a doctoral fellow in the Malaysian Research Institute on Aging, working on projects on post-stroke and osteoporosis. She is also a council member of Fragility Fracture Network Malaysia and the pioneer for the geriatric service in UPM Teaching Hospital. Her previous projects were the development of a Malaysian undergraduate geriatric medicine curriculum and a nationwide survey on teaching provision of geriatric medicine among medical schools across the country. She was one of the task force members in developing the interim recommendations for the COVID-19 pandemic for private, public, and NGO residential aged care facilities in Malaysia. She is the co-author for the Malaysian Education Certificate, SPM Vocational Subjects Textbook Gerontology dan Geriatric Asas Tingkatan 4 dan 5, and a book on dementia care, Dementia, a Caregiver's Guide. She has ongoing research on dementia, malnutrition, frailty, medical education, and bone health among older adults. So without further ado, let me pass the floor to you, Dr. Hakima. Thank you, everyone, and enjoy today's session.
Thank you, Kitara. Right, so good afternoon, everyone. Assalamualaikum. I can see a few familiar faces here. Yeah, so welcome to the session. I'm truly honored to have been invited by Act for Health as a speaker. So this is our second, I think this is my second talk with Act for Health since the pandemic started. Yeah, so the topic today would be Technology 101. Just let me share the slides. Oops. Okay. Let me know if you can see my slides.
Yes, we can.
Yes. Okay. So the topic today would be very simple. It's very basic. Since we have a small number of us, so I hope we can actually more to chit-chatting with each other and then share experiences. What are your concerns? Okay, about technology among older adults. Okay, so as this is a topic aimed towards independent living, so mostly I will skew towards healthy older adults, other than the ones who are cognitively impaired or severely disabled. Okay. Right. So a few content of my talk would be some introduction. We're going to go through types of technology out there, a lot of them. Okay, and then I will talk about what are your needs and how to actually match your needs and the technology. Okay, and some conclusion from the talk today. Right, okay. So some introduction. So this is data from Korea. Household with one person older than 65 years old living alone is actually expected it to be up to 3.72 million by 2045. Okay, so I think this is because when the family grew and the fertility rate reduced, so they are separated among each other. Okay, so at the end, the parents lives alone and the children lives alone. Okay, and then that seems like the trend today. Okay, and then what happened if you see in America? Okay, so one is in Southeast Asia and one in America. It's sort of portraying about how about the self-care and independent living, and then ambulatory people, about those who are age 80 and above. And these are the graphs. Okay, so it looks like single person, okay, basically more ambulatory, okay, more in independent living and more in self-care. Okay, but there is reported more difficulties. Okay, so more difficulty in self-care, more difficulty in having independent living and ambulation compared to people with who are married. Okay, so seems like those who are married might have some help, okay, rather than single person. Right, but these are the trend that we can see worldwide. Okay, but having said that, global population is aging and is rising. Okay, so the number of people in the world age 80 and older is expected to grow past 2 billion, okay, in the next 30 years. Okay, and as we can see, they are actually higher in developing countries compared to the developed countries. Okay, mainly because the developed countries are already aged country now. Okay, and we are actually starting as young countries, Malaysia, India. Okay, so these are all young countries, but now you can see the aging population is increasing. Okay, and as life expectancy is longer, okay, in developing countries, even in developing countries, we can see the healthcare is better, yeah, the support in financial system, okay, in our healthcare system is better, so the longer life expectancy. But with that life expectancy, you have to bear in mind, yeah, the disability, some impairment that aging can bring. Okay, so that's the reason why I think our country is pushing towards healthy aging now. Okay, and bear in mind, as we age, our kids also age. Okay, so sometimes when the kids age, they really want to have their own place. Okay, they want to live by themselves, things like that, rather than the traditional family before our generation, that we love to live with each other. Okay, so even personally, me and my family, when my family grows and we thought of having our own place, and my parents was like saying, do you need to go out of the house? Why don't you stay with us? So at the end, we decided to stay near to each other. Okay, yeah, things like that. And then when this is in the US as well, okay, the figure on the right side. When we do a survey, okay, most older adults want to age in place. Okay, so among those who are 65 years old and above, this 61% of them say they want to stay at home, but to have someone to care for them. Okay, so but bear in mind again, this is US citizens. Okay, so this is in America. In Malaysia, it might be different. They want to stay at home, but they want kids to, to take care of them. Okay, things like that. Or they move into assisted living facility. Okay, there are a lot in the UK, in the US. Okay, they have assisted living facility. And we can see in Malaysia, it's actually increasing in number. Okay, but again, when you are given a choice, okay, whether to stay at home with someone to care for that, for you, or moving into an assisted living facility with new people, new friends, okay, new environment, living behind your home with full of memories. Okay, do you want to do that? Things like that. Okay, and only 8% of people in America wants to move in with a family member, and then of course there are only a small amount of them would move into a nursing home. Right. Okay. So moving forward, what are the types of technology out there? Okay. I'm not an expert in geron technology, although I have a few study on geron technology. Okay. But we're working with engineers. Okay. So I'm started to learn about this as well. Okay. So about sensors for remote monitoring. Okay. So previously we know these are the things. Okay. How we use speech recognition software, Siri, okay, Google Voice, things like that, okay, and then artificial intelligence, where robots, robotic platforms, kan? They are newly developed. Okay, so even in some country they have autonomous vehicles. Okay, software, we can see that virtual communities to reduce social isolation. We can say that software is quite friendly to us here in Malaysia. Um, Most of our adults can use Google Meet, can use Zoom, especially during the pandemic. Okay, so they are forced to use this. Even the youngsters as well, okay, like me, like the lecturers in the universities, okay. So we are really afraid of this software before this, how to use Google Hangouts, Google Meet, but nowadays it's just like the normal for us, okay. And wearables, okay, so like fall detections. I'm going to talk about each and every one of them later. How to use how would wearables work, and then mostly they are used for fall detection, and then how to ask for help, and also can be used for health monitoring, okay, like your pulse, your blood pressure, your temperature, your SPO, your oxygen saturation, call it SPO2 monitoring, yeah. Cool. So these are wearables. And last but not least is virtual reality. Okay. So virtual reality is mostly used among people with dementia. Okay. For them to have a soothing environment. Okay. So let's say they are very agitated, and you put it, you can see the sea, you can see the ocean, things like some simulated environment to soothe and engage dementia patients. Okay. So these are virtual reality. Right. So moving forward, this is the first thing that we said previously. Okay, so this is the sensors for remote monitoring. Um, a lot of sensors out there. Basically, in Malaysia, is still new. It might be costly as well. Where this is called smart home. Okay, when you have sensors everywhere. Okay, like when the room is dark and you go into that room, and the motion sensor lights up the whole room. Okay, and when you go out of that room, there's no people there, the light turns off. Okay, so this is motion sensor. It is good for older people who wakes up at night. Okay, older people sometimes they wake up at night, to go to toilet, right? And they have difficulty moving, okay, finding their walking aids, and then some more they want to find the switch to turn on the light, okay, and this is good. Okay, so motion sensor is good, just put next to the bed, okay, and when you move, the sensor turns on the light and you can go to the toilet and things like that. Okay, security, okay, so they can see whether the door is closed or the door is locked, okay, at night. So let's say you already go to sleep, but then your front door is still open, okay, and the sensor basically can sense that the door is still open and it's not locked, okay, and it can send some alarm for you, and okay, and then you might go lock the door. Some house has this automatic door. When you close it, it automatically close the door. The door automatically locked. Okay. My parent had this door in their house. Okay, so it's really difficult to if you are it's really difficult to let the door open lah. Let's say like one day I went in and then didn't close the door properly. It started to when the alarm started to went off, ding, 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 ding. Then it's really really noisy. Okay, so basically you are forced to actually close the door and it actually locked for you. And when you want to open the door, just push the knob and it automatically open from the inside. Okay. Right, okay, lighting control, whether you want to control it, the dimming, okay, you want it to be brighter, things like that, okay. So window control as well, and energy management, okay, so energy management is important. Some houses which are built to preserve energy, okay, so like an aircon, when no people there, the aircon will go down. I mean, the temperature will go up. Okay, the temperature will go up. Okay, so basically less cold in that area, and then when there are people in, so the temperature goes down, so it becomes colder, the room becomes colder, so it controls everything. Okay, like thermostats in there. Okay, so you got some remote control. Okay, and then basically these are the things that we can use. Okay, so just bear in mind whether we really what are the kinds of things that is important to us. Okay, so by the end of the lecture we will talk about how to map your needs and the technology. Okay, right. So this is how, let's say, your daughter wants to the daughter wants to monitor the mom at home. Okay, so let's say daughter is there during daytime, during nighttime, but during daytime she goes to work. Okay, but she wants to monitor the mother at home. Okay, is the mom safe? Okay, is the door locked? Okay, how about the light? Okay, did the mom fell down? Okay, how about the temperature of the house? You know, things like that. Okay, so let's say if this sensor actually goes to the cloud, and then goes to the smartphone, and then it talks about where's the mom. Mom is in the kitchen. Okay, so you go about energy saving, when the mom go to bed, you know, things like that. Okay, so there are pros and cons of this system. Okay, what do you think about the cons? I think the cons would be the privacy of the mother. You know, being watched. Okay, whether you like it or not, being watched, every steps of you're being watched, whether you like it or not, things like that. Okay, so this is one of speech recognition software. So let's watch this. Can you see this? I hope you can.
If you want to lose a serious amount of weight and shock everyone in your family and at work, next time you go out, then stop everything you're doing because
Right. Okay. So that's one of the speech recognition software. Okay. So we have it like Siri in iPhone, and then Google Voice, right? Okay. So how about AI and robotics? Okay. So let us see what is that. A short video.
I'm sorry, Dr. Hakima. Actually, we can't hear so much. Could you increase the volume?
Oh, okay.
Yeah.
Is it? Is it okay?
Maybe slightly louder.
Okay.
Yeah, much better.
Okay.
Okay,
Sorry.
thank you.
remember to take your morning medication, Anthony.
And every time we had some type of communication, we'd introduce it. Seniors would give us feedback, oh, we don't like this, we don't like that. We'd come in and change it.
Okay. Early age, I saw both aspects of it as I grew older. So you don't want to make decisions for you. You want to help them make decisions. How that so they listen.
Hi, good afternoon. Did you take your medicine this morning?
Yes.
Okay, wonderful. Did you sleep okay last night?
Yes.
Okay, good.
So, Lisa, I'm in. So, Let's go. So here he's able to help carry things for me. Leveraging artificial intelligence with our platform to consumers make better decisions to allow them to stay in their home, which according to AARP, 90% of them want to stay in their home. And the longer we can keep them in their home, the happier they are. It's really good.
Right. Okay, I'll stop there. Right. Okay. So moving on, we're going to talk about wearables. Okay. So these are some types of wearables that can be used. When I Googled, there is one in the market by a Malaysian startup company, Preventech, I think. They actually designed something like that, like this. This is like smartwatch, and it has blood pressure monitoring, pulse rate, and then when the fall is detected, you can push an SOS button. Okay, so it's something like this. Okay, so whether it is a smartwatch, whether it is a pendant, okay, it is there. Like this one is available mostly in the Western countries. So when I was in the UK, you have this fall detector. Okay, so it's either the pendant alarm or a smartwatch. Okay, so you can choose, and then there is the other system is this one. This one is the receiver. Okay, so when you push the button, it goes to the receiver, and the receiver will actually call the person that that is supposed to be called. Okay, so either it's your family members. Okay, so either your daughter or the close family members, or the center. Okay, the call center. Okay, to have this system, basically they need to have a central system that sort of to be the center to receive all the calls. Okay, and they will call back whether they are okay or not. Okay, whether they need to be sent to hospital or not. Okay, so these are the device. It comes with cost. Let's say just like a telephone bill that you have to pay like 200 ringgit per month for the service. Yeah, so it's the same like this. Okay, so look at the pendants. Okay, so which type of pendants do you think older people would like to have? So either like this one, the right lower ones, this is the traditional ones. Okay, or this one like a jewelry ones. Okay, so and then the left upper is the one that I got from Preventech Malaysia. Okay, so this is the interface whereby the smartwatch that they have actually can be monitored through this mobile applications. Okay, so you can see where you are. Okay, you're calling. Okay, you can see your how many steps per day you take. The things like that. All right, so this is VR. I'm not going to go through VR that much because I'm sure you're very much know what VR is. Usually it's used among gamers and youngsters, okay? But we do have virtual reality for older people, mostly for leisure activities, okay? For them to be calmer, okay? So to have them, to have their cognitively stimulated, okay? So this is the VR. And assistive devices, okay? So if you want to be independent with mild mobility, okay, and not talking about severe mobility, whereby you can still move around alone, be independent. Okay, so they are assistive devices. Okay, so like this one, it helps you to wear shoes, okay, without having to bend so much. And this is chair. Okay, stair lift. They call it stair lift. Okay, so those who live in the second floor and the stair lift. Okay, so in Malaysia it costs around 15k, 20k, something like that. Okay, and this one, then the left upper, is like a scooter. Okay, we have this in some malls, shopping complex. I've seen this. Okay, but they're not on the roads. Okay, not on the roads yet. Right. Okay, so this is smart home. Okay, so when you talk about smart home, basically everything is censored. You got sensors everywhere. Okay, like you got wearable sensors. Okay, like we said just now, and you got activity detection if you fall. Okay, you got CCTV here, and then what happens if you fell down, and then your sleep will be monitored. Okay, environment will be monitored. And you got home security system, of course, your CCTV, and then your intercom, and energy management. Yeah, okay, and then home automation. Yeah, and of course remote service platform. Okay, so this is where we need to pay for the service. Okay, so because they must have a central call center. Okay, monitoring all this in out. Okay, sometimes when I was in the UK, the older people, when they fall down or they accidentally press the button, right? And that happens one day when I was doing a home visit to these older people, to this old, I think this is a gentleman. Okay, so we are doing a home visit to see whether she's safe at home. She was just discharged from hospital. Okay, so just to see whether she's safe at home, to assess the home situation. And apparently she got this pendant. Okay, so she's afraid to test it. Okay, what happened if I test it? Okay, will it blow away, things like that. And then the occupational therapist is just like convincing her, no, you can just press it and then just tell the center that, oh, you are testing. So she pressed the button, and then straight away, within 1 minute, okay, the center like call her again. Hello, Mr. Let's say it's just Mrs. T. Hello, Mrs. T, are you okay? Did you fall down? Is everything okay? No, and then she said, oh no, I'm just testing. Oh, all right, okay. So they just, um, uh, put down the receiver. So that's quite nice, okay? So you just have to test it. So the maintenance is there, right? Okay. So this is smart home. Right, so how to identify your needs? Okay, so there's a lot of out there, a lot of technology, but you have to identify your needs. Okay, because sometimes if you don't identify your needs very well and you don't map it, you might not find the technology that suits your need. Okay, so how do you do this? Okay, so identifying the technology domains and your need. Okay, so this is one important slide. It's quite a busy slide, but I can just portray it to you how you do mapping. So when we live alone, we want to know what are our needs in technology. You need the technology for household items, okay, day-to-day activities, okay, like activity of daily living, or you need technology for social, or you need the technology for your financial, okay, or your health, okay, the safety and organizing. Okay. So most of us, most of older people will need the technology. Okay, so we'll need the technology for health. Okay, so most independent older adults will need the technology for health and safety, and then something about household items. Okay, and social as well. Okay, social as well, but not so much on financial and organizing, because if you have an intact cognition, okay, your memory is still good. Okay, you're still able to think things thoroughly and organizing things. You might not need a technology for this finance and organizing. Okay, but then look at this, like for example, you got household items, you got some electric kettle, okay, automatic vacuum cleaner. Okay, so a lot of people have automatic vacuum cleaner nowadays, and then you list down, okay, what are the household items that you need. Okay, like social technology. You need a social technology because during the pandemic, let's say during the pandemic, you live alone. Okay, so we need video calls. Okay, whether we need tablet to see things bigger, to see the face, people's face bigger. Okay, and then things like that. Okay, financial. Okay, so this is automatic bill pay. Okay, and then health. Like say pill boxes or alarm. Okay, some alarm clock or anything like automatic or organizer. okay, for your pill. And then health also includes blood pressure monitoring, okay, and pulse rate monitoring. If I'm not mistaken, even iPhone watch now has this rhythm monitoring, heart rhythm monitoring, whether you have a regular heart rhythm or irregular heart rhythm, okay, up to that level, okay. And then safety, okay, so don't forget about smoke detector, okay, especially if you live alone and you still cooking, okay, smoke detector, okay, is important. And then of course, if you have recurrent fall, okay, you need to have a measure how to ask for help, okay. So live alert buttons, okay, especially people who has like heart problem, okay, sometimes you got chest pain and you don't know who to call, and maybe the telephone is far away, things like that. So this is called the buttons, okay. So you can just tick the buttons. Okay, and you have the watch just now. You have the watch, you can just, there is a big SOS button, then you can push to ask for help. Okay, so it can go straight to your family members. Okay, and last but not least, fall detectors. Okay, so this is for safety. A lot of things that's concentrating on safety. Okay, so this is my conclusion slide. So first and foremost, older adults prefer to age in place. We know this. Okay, so what we want is independent living. But having said that, aging leads to physical and mental barriers. Okay, so for this, we really need to start to have a healthy aging. Okay, so to make sure that we stay independent. Okay, and when you start to have physical and mental disability, but you want to stay independent, okay, in some sort, we can. This is where the technology and AI offers much needed help. Okay, so but it depends on the affordability and the accessibility as well. And as I said before this, older people might be reluctant to take up this because they know the privacy. They must be has some intrusion of privacy. Or my daughter is watching me, things like that. Okay, and then at the end we have the mismatch, okay, between needs and tech. Okay, so this mismatch between needs and technology actually hinders adoption. So a lot of research nowadays when they want to do when they want to develop a technology, just now like the robot just now, so they co-design the tech. Okay, so that is the meaning of co-designing the technology, to understand what the older people needs and how the technology basically can fill that gap, okay, and address that needs. All right, okay, so thank you. So you're going to always listen when we talk, and when you talk, we listen. Okay, so this is my email. I can be reached at any time. Happy to answer questions. Thank you.
Okay, thank you so much, Dr. Hakima. So before we proceed to Q&A, I kind of forgot to do this earlier, but does everyone mind if we take a group picture first? So we would appreciate if you can just switch on your cameras and a very quick group picture. Okay, just give a few minutes to everyone. Okay, never mind. Let's just proceed. Okay, ready? 1, 2, smile. Okay, very nice. Okay, so let's move on to question and answer, Dr. Hakima. Anyone has any questions for Dr. Hakima, please feel free to unmute yourself and share your question, or you could even type it out in the chat box.
I can see Kausar there. Kausar is doing a PhD on Jurong Technology on an app on falls. Right, Kausar?
Yeah.
Yeah.
Hello, everyone.
Yeah, and she's doing a
Hi.
collaboration with the Japan company, right?
Oh,
Yeah.
okay.
Mm.
Okay, I believe.
Dr.
Oh,
Hakima.
Hi.
Hi, my name is Liu. You can call me Liu lah. Liu Xin
Hi,
Liang,
Liu.
and currently I'm studying PhD in UPM also, and my one is related to retirement village. Yeah,
That's nice.
I hope to yeah. So far I have a questions for you lah regarding the smart technology, right? So may I ask you what are the level actually what are the level of acceptance among the public in Malaysia, especially for the elderly people towards the smart technology? Yeah, do you know it, how the level of acceptance? I mean, yeah, towards the smart technology.
It depends on your population, the population that you cater. So some people doesn't like smart homes. Okay, so doesn't like smart homes, basically because there's a lot of technology. But some people likes it. Okay, and the only thing that hinders is basically cost. Okay, it's basically cost. But having said that, a lot of people who are having families overseas now. Macam the families, the kids are overseas. I mean, far from them. Okay, living far from them, and they are basically um, the parents, the married couples, husband and wife. Okay, they're living by themselves. Okay, so these are the people who might want to be in your village. Okay, so I mean, grow older together. Okay, and having said that they don't want to be a burden. They always feel that they want to be a burden. If they fall down, they're sick, they have to call the family members from overseas to come to their house. No, they don't want that. Okay, so this might be the people who will be open to your offer. And then about if you open the village, what level of, when you say about smart village, what level of people would you cater? Would you cater the independent people, or you would cater people with dementia? Okay, because their needs are different, right? So people with dementia sometimes would be really afraid if suddenly the light turns up. They'll be shocked. Okay, so you have to know what level of cognition also.
All right, thank you.
I believe Mr. Shiva has, do you have a question?
Yes, Doctor. Good afternoon. Good afternoon, Expo Health team. Yeah. My question is this. In the last 1 month, I'm with several WhatsApp chat groups where there's senior citizens involved. And in the past 1 month, we have seen there's already been 3 cases of elderlies walking out of the house and cannot be found. Okay. Now, we have recommended actually just put a wristband with your contact number. Which is something very simple to do. Those rubber wristbands, which they can't take out, they can't tear, but put with a phone number. But I just want to know whether you have come across any with smart tech with a smartphone connection, so that the family can actually trace them rather than someone discovering them, because discovering them is already a problem. Someone needs to approach them to ask them or to check on them. But like sometimes they're just sitting under a bridge, honestly, sitting under a bridge, and nobody can find them. So have you come across any of these rubber bands, the one they put around the wrist, which are connected to a smartphone?
So that's the one that I talked just now. Am I allowed, Kitara, to share the website? I have their website.
Yes, no problem.
So this is let me see if I can share this. Okay, so there was one developed by our it's not by NASA, but our Air Force, I think. But the uptake is really low because it's quite bulky, right? So if you see this, okay, can you see my screen?
Yes.
Yeah, so this is a website, kan? Prevent Tech. Okay. It says that it's first Malaysia Malaysia's first elderly response smart band. Okay, so if you see this, the features is quite tempting. It's quite enticing as well. Okay, so because it has okay, so if you click buy now, how much you think it costs? It's 400 ringgit. Yeah, so it's 400 ringgit, and then you got health and safety smart band. You got touch screen. Okay, so you got this button here, and then so you can making call and receiving call directly to the smartwatch without needing to connect to a phone. That's what it says. Okay, GPS tracking capabilities and things like that. Yeah, okay, so you can go through. I think they are on live in BFM as well. So maybe you want to see this. This is the first thing that I saw in Malaysia lah. I think this is only a startups. So and it's quite affordable, and I don't think it's bulky as well. It also comes with the luxury and stylish things. Yeah. Yeah, things like that. So maybe the older adults are more open, you know, are more open to wear this.
Okay, often I can tell you this much, doctor. It looks good and all, but we're talking about people with Alzheimer's dementia. And one lady I know, her father actually, when he walked out of the house, he got robbed. So whatever fancy gets taken away. So we need something which
not so fancy.
Yeah, something like this looks good. It's great if they are cognitive, but the fact that they walked out of the house, can't find their way back. There's a the mental capacity is diminished. They can't even protect themselves. You see. Anyway, it's good for me to know. I will just take a little bit of a study on it later. Thank you.
I agree. Yeah. So that is always our concern. The dementia people go out of the house, door unlocked. So things like that. So whether we need, the thing like door automatically locked. If it's not locked or it's not properly closed, it will give siren. Okay, then you know that something is going on. Right? Whether the elderly is going out of the house because there's siren, going out. And when you go in, the doors automatically locked. Yeah, that one we have in Malaysia. Okay, safe door.
Okay, thank you, Dr. Hakima. I think Nadia, you have your hand raised. Would you like to ask a question?
Yeah.
Okay, go ahead.
Assalamualaikum and good evening, everyone. And to Doctor, my name is Nadia. I'm a PhD student from UPM, and right now I'm studying the perception of the elderly towards the retirement village, which is also the same topic, the same field with Mr. Liu. And may I know, is there a demand for this smart tech for the elderly in Malaysia? Because the thing is, I think we already know that there might be a demand from the people who stay in the city, but what about the people who stay in the kampong, in the village? And another question for me is there any rebate or maybe a tax exemption from the government for the elderly to support this kind of smart tech?
Good questions.
Thank you.
Yeah, because I think people in the village are still thinking of family to take care of them. So these are the perception. They're not so open towards living alone in the smart village, things like that. But bear with me that these things might change. Okay. Regarding the rebate, I don't think there is a rebate for now for people who are living alone, unfortunately. But then the rebate goes to those family members like a daughter or the son who take care of the elder people. So you understand, right? Because in a way our government supports caregivers among family members to take care of the older people, but didn't put emphasis on the older people to be independent, right? Yeah, because there's no support in that terms. Okay, so we are hopeful that the smart villagers, all these fall prevention measures, like even the service in the UK, it is partially, some center it is partially subsidized by the government. That service yang RM200 per month, let's say, right? Because the people wants to be independent. It's their right to be independent. We know if they are not safe to be at home, if you want to send your parents to nursing home, the parents must agree to go to the nursing home. If the parent doesn't say I don't want to go to nursing home, then it is their right basically to be independent, to live in their own place. Yeah. So some people like I said lah, I don't have time because during daytime I work. I only have time during night time. Okay, but the mother is not like bedbound. They can just walk around, but unsafe. Okay, so these are the gaps. Okay. So when you talk about smart village, it's a good initiative, but you have to know about affordability. Okay, how affordable is it, and accessibility. How accessible is that village to the population atau population?
Okay, thank you so much, Dr. Hakima. Anyone else? Any questions?
Anyone wants to add?
Yeah.
I'm open. So,
anything to share?
I saw Dr. Harzana there.
Okay.
Hello. Hi, I'm Dr. Hazana, FMS from Pandamaran. So it's thank you, Dr. Hakima, for sharing your information. It's actually very useful information because especially I'm actually now doing a subspecialty in geriatrics in primary care. So I'm from a suburban area, which is in Klang district in Pandamaran. So if we look back at the previous question by Nadia, it's actually is actually um, um, I also want to know how deep I can go to share this information to them, because majority of my community is actually poor in a social economic factors, but they also have what you call that poor family support. And yeah, I think if the rebate is actually goes only to the caregivers, I think this is actually not really, yeah, that's how, I mean, maybe how to proceed with this. I mean, this is another thing that we should think forward. Okay. And I mean, when you say about the rebate to the caregivers, is meaning that they can claim under which is JPA or what?
This is under Jabatan Kebajikan Masyarakat.
I see. So it's a true medical social worker.
Yes. So if you refer to a medical social worker, so look, this family had financial problem. Okay. So and let's say the parents are needing help, 24 hours help. Okay, like patient with dementia. Okay, like patient yang bedbound. Okay. So they will give around, I think, if I'm not mistaken, it's up to RM600 for the caregiver. Okay, because some caregiver needs to stop working just to take care of their parents.
Yeah.
Yeah. Okay. So these are the initiative of the government lah. On top of that, the usual support, financial support for B40. Yeah, they're still there. Yeah.
Okay. So this is part of B40 as well as, is there any what do you call
No,
that?
caregiver is not part of B40. Caregiver is on its own. We know that, but then a lot of us doctors doesn't know that all this help actually is there. So we don't refer to social worker. Right? So
but some of the medical social worker don't aware about this. I mean for the walking aids, for the medication that not available in our clinics, that one maybe we can get quotation, something like that. But this is, I mean, is it same process that we have to get the quotation, something like that, from that company if we see that the older person is actually agreed to use wearable, that let's say wearable gadgets, something like that, that costs 400, and then we liaise with the medical social worker and then give the quotations, and then is that the way? I'm not sure, just
No,
Just
the gadget. I don't think the gadget is covered. The gadget
uh,
is not covered.
it's not covered.
Yeah, the gadget is not covered. Yeah, so that's what Nadia talk about the policy. What's our policy on the subsidy the government give for this independent older people who wants to age in place but needs technology.
But they give money.
That's the gap.
Yeah. Okay. All right.
For the caregiver.
But our government just only support the poor group rather than the rich group, because why not we give the money to the rich group that able to take care of themselves? Yeah. Yeah.
Yeah. So the priority lah. I think
Yeah. But Dr. Hagima, your research is doing sounds like smart technology, is it?
no, my research, my PhD research in posture osteoporosis, nothing to do with technology.
Oh, I see. Okay.
Yeah, but what my student had is doing like a technology for dysphagia patient. Yeah, swallowing difficulties and things like that.
Okay.
Want to add on anything? Salsa, you want to add on anything?
If I may add, based on my research, the survey we did about the perception of older adults, they are actually very interested to use the fall detection device and everything. But of course, their concern is the safety when using the device. Yeah, majority of them are interested, but they're asking on how is it going to be like is their life gonna change something like that. Yeah, the concern is safety and privacy as well. Yeah,
Privacy is a big issue when you have the sensors around your house. Yeah, you are being watched. Yeah.
and one thing is the cost also.
Okay, thank you for sharing. Anyone, any other questions to add?
I'm not sure whether in Malaysia we have an expo, like a yearly expo. Maybe Act for Health can do it, can initiate that. A technology expo for older people. Where all the startups company can gather together, and then all the older people can go to their booth and then give their input. Right.
Yeah,
So they will go,
sounds like a plan.
this is good, but this is too bulky. So the startups will know, that's too bulky, so they can change. Things like that. If they like to buy, okay, I like this. Then they can buy and then see their feedbacks. Things like that. So it's like an expo. It's quite unfair when you have PCOM for the teenager and middle age, right? Yeah, like a yearly thing. And my husband got this diving expo yearly for divers, but we don't have expo for all the adults. Technology for all the adults. Yeah.
It sounds like a plan. Yeah. Okay, so if we have no more questions for today, or if you would like to share a bit more, please send us an email or send Dr. Hakima an email if you have a contact number, and then can carry forward the conversation from there. So meanwhile, thank you everyone for joining us this evening. I hope everyone has a pleasant rest of the weekend.